Internal bleeding. Unlike external bleeding, internal bleeding presents a more insidious threat. It is a medical emergency where blood leaks from damaged blood vessels inside the body, potentially leading to life-threatening complications. Imagine a scenario where a seemingly minor fall leaves no external mark, yet beneath the surface a crisis is brewing. A ruptured organ or torn artery can silently spill blood into spaces within the body, disrupting the delicate balance of life. It is crucial to be aware of the potential causes, recognize the often subtle warning signs, and understand the importance of immediate medical intervention. This essay will delve into the complexities of internal bleeding, shedding light on its causes, symptoms, diagnosis, and treatment. Internal bleeding occurs when blood escapes from the circulatory system and accumulates within the body. When a blood vessel is damaged, blood can leak into surrounding tissues, organs, or body cavities. This internal blood loss disrupts the body's delicate equilibrium. As blood pools in areas where it shouldn't, it puts pressure on surrounding organs and tissues, potentially impairing their function. The reduction in circulating blood volume reduces the amount of oxygen reaching vital organs, leading to hypovolemic shock. The severity of internal bleeding depends on the source of the bleed, the rate of blood loss, and the overall health of the individual. A slow, chronic bleed may manifest with subtle symptoms like fatigue, while a rapid hemorrhage can quickly escalate into a life-threatening emergency. Recognizing the signs and symptoms and seeking immediate medical attention are paramount for a positive outcome. Internal bleeding can arise from a variety of sources, ranging from traumatic injuries to underlying medical conditions. One of the most common causes is trauma, such as that sustained in a car accident or a fall. The impact can rupture internal organs, tear blood vessels, or fracture bones that sever arteries or veins. Certain medical conditions can also increase the risk of internal bleeding, including aneurysms, ulcers, and certain types of cancer. Individuals taking blood-thinning medications such as warfarin are at an increased risk of internal bleeding. Similarly, people with inherited bleeding disorders such as hemophilia are more susceptible. Understanding the various causes and risk factors can help individuals minimize their risk and be more vigilant in recognizing potential warning signs. Section 4. Unmasking the invisible. Recognizing the symptoms. The challenge in diagnosing internal bleeding lies in its often subtle nature. Unlike external bleeding, internal bleeding can occur deep within the body, masked from immediate view. However, our bodies often send out warning signals. One of the most common symptoms is pain, varying in location and intensity. Unexplained bruising, particularly in areas not prone to injury, is another telltale sign. Pale skin, dizziness, shortness of breath, rapid heartbeat, and confusion are also symptoms to watch for. These symptoms are often associated with hypovolemic shock, a life-threatening condition. Section 5. Diagnosis. Shining a light on hidden hemorrhages. Diagnosing internal bleeding involves a thorough medical history, a physical examination, and specialized diagnostic tests. Doctors will inquire about recent injuries, medical conditions, medications, and family history of bleeding disorders. Imaging tests play a crucial role in visualizing potential sources of internal bleeding. X-rays can reveal fractures or injuries to internal organs, while CT scans provide detailed cross-sectional images. Ultrasound is particularly useful for detecting bleeding in the abdomen or pelvis. Prompt and accurate diagnosis is essential for determining the appropriate course of treatment and improving the chances of a positive outcome. Section 6. Stemming the tide. Treatment and management of internal bleeding. The treatment for internal bleeding depends on the severity of the bleed, its location, and the underlying cause. In some cases, the body may stop the bleeding on its own, particularly if the blood loss is slow. However, medical intervention is often necessary to control the bleeding and prevent complications. For minor bleeding, doctors may recommend close monitoring, bed rest, and medications to slow the bleeding. Intravenous fluids may be administered to restore blood volume and prevent hypovolemic shock. In severe cases, surgery may be necessary to stop the bleeding and repair the damaged blood vessel or organ. The goal of treatment is to control the bleeding, stabilize the patient's condition, and address any underlying medical conditions. Section 7. The urgency of now first aid and seeking immediate medical help. Internal bleeding is a medical emergency that requires immediate attention. Recognizing the signs and symptoms and seeking prompt medical care can be life-saving. While waiting for medical professionals, call 911 or your local emergency number immediately. Keep the individual calm and in a comfortable position, preferably lying down with their legs elevated. Avoid giving them anything to eat or drink. If they are experiencing external bleeding, apply direct pressure to the wound. Once medical professionals arrive, provide them with as much information as possible about the individual's medical history and the events leading up to the suspected internal bleeding.